Hi, I'm Dr. Yvonne Huang. I'm a physical therapist here at Rehab and Revive. Today, I'm going to show you how to massage your scar to decrease adhesions, which is going to promote blood flow to the scar area to promote flexibility of the scar. You can perform this massage for about 3 to 5 minutes and 2 times a day if you need to. If you have a raised scar after performing the massage, it might flatten the scar, or if you notice your scar is being pulled inwards towards your body after the scar massage, it can also cause it to kind of pull it back up so it's a little bit smoother around the skin area. Okay, so I'm going to show you how to do a scar massage on a client here. So pretty much you have to do it on yourself, but I'm going to show you on the direct scar so you know how it's supposed to look like, okay? So I'm going to start with, if it's a fresh scar, usually you want to start just next to the scar. Just do a gentle stroke like so. You can do perpendicular to the scar, or you can do side to side next to the scar. And usually the two ends are more adhered, so you can get to the end of the scar. Again, perpendicular, side to side, or you can do circles. And let's get down here. And once you feel comfortable to get on the scar itself, then you just place your finger directly on the scar. You can do 2 fingers like so to do it, or you can kind of double out your fingers like so. Okay. Do perpendicular direction. Just apply gentle pressure down first, and then you're going to go perpendicular. Or you can do directly on the scar, side to side. Usually side to side is a little bit easier than perpendicular. Perpendicular, you're definitely going to feel that scar tissues a little bit more. And then once you feel like this is loosening up a little bit, then you can do circles. And make sure you cover the entire scar. So on this client, we can feel a little bit more scar tissue develop down at the lower part. So we're going to kind of work on that a little bit more. Here's the end of the scar that's pretty adhered. And then lastly, if you feel comfortable, you can start doing bending. As you can see, the scar doesn't bend very well. Right? So you can do some bending on the scar. And the most uncomfortable one is you're going to pick up your skin and you're kind of going to roll on the scar. As you can see, it's quite difficult to pick up the scar and to maintain it to roll. But ideally, it's going to be kind of like the skin right here, and then you kind of hold on to that, and then you just kind of roll it. So on the scar itself. You really just have to pick up the scar and do your best, right? And as you can see, this client, his scar is pretty here, so you probably just wanted to spend a little bit of time at that adhere part. Just kind of squeeze it, lift it, and then just try to roll it. If your scar is fresh, please make sure you wait it at least 6 weeks so that scar is fully closed before you start performing the massage. Or follow your doctor's order before you start massaging the scar. I'm Dr. Yvonne Huang here at Rehab and Revive Physical Therapy. Thank you for watching.